Our institution is a major tertiary hospital in Singapore. We screen and treat patients with iron deficiency anemia with Ferinject prior to major elective colorectal surgery in the perioperative clinic. These are some key findings. Anemia is associated with poorer perioperative outcomes and should be optimized. We implemented a preoperative anemia management protocol to identify and treat moderate to severe iron deficiency anemia with Ferinject in 2019. We aim to assess the compliance to iron deficiency screening and treatment, improvement in HB following treatment with Ferinject, and outcomes related to treatment such as length of stay, time to recovery of activities of daily living, change in pre and post-op WHO performance scores, incidence of readmissions, and intra-op blood product transfusion. Statistical tests used are marked in brackets. Our Enhanced Recovery After Surgery database had data on compliance and outcomes from 2019 to 2024. Pre- and post-treatment HB and time from treatment to surgery were only available from our preoperative clinic from 2023 to 2024. 97% of all major elective colorectal surgery patients were screened for anemia, of which 26% were iron deficient, and 70% of these were treated with Ferinject. 60 iron deficient patients were treated with Ferinject from 2023 to 2024, of which 46 had their HB taken both prior to treatment and just prior to surgery and did not have a pre-op blood transfusion within 3 days prior to the operation. There was a significant rise in mean HB of 0.442. There was no significant difference in all outcomes of interest between patients treated with Ferinject versus those who were not given Ferinject, and likewise between those treated with Ferinject and those not treated with any form of iron at all. We achieved good compliance rates and found a small but statistically significant rise in HB following treatment. Peak increase in HB levels occurs 2 to 4 weeks after Ferinject, but colorectal surgery is time sensitive and the median time from first Ferinject treatment to the operative day was 8.5 days. However, patients may still benefit post-operatively from enhanced iron stores and ability to increase HB. The PREVENT trial found an increase in HB but no significant difference in blood transfusion or death after preoperative IV iron therapy. A difference in recovery outcome and intra-op transfusion rates were similarly not found. One limitation is the retrospective nature of this review and the small size for the non-treated population. However, it is well recognized that anemia affects perioperative outcomes and improving HB perioperatively can improve post-op outcomes. Larger prospective studies addressing important patient-reported outcomes and experience measures would be helpful in addressing this.